here's Anne, and today I will be discussing about myocardial infarction, which is also known as the heart attack. Okay, what is myocardial infarction? It is an irreversible tissue death of the myocardium due to severe or prolonged blockage. Myocardium, this is the one which is responsible for our heart's contraction. Okay, there is a feeling of what they call impending doom and a crushing chest pain that radiates to the left arm. Okay, left arm. A chest pain that does not subside with rest and nitrates. Okay, let's now proceed to our risk factors. First, we have smoking. It causes coronary vasospasm, and it also puts the person at risk due to its toxic substances. Second, we have the sedentary lifestyle. They lack physical activity. Type A personality, they are hyperactive, impulsive, perfectionist. In short, they have a very stressful life. Fourth, obesity. I will write here high LDL and high triglycerides. They have a high cholesterol level, specifically the bad cholesterol, which is the low density lipoprotein, and a high triglyceride level. They stick to the wall of the arteries and produces plaque that blocks the blood flow of the arteries. Next, we have diabetes mellitus. In this case, here we have the high blood sugar level. Having this condition, your blood sugar level is high. This causes blood viscosity, which can damage the blood vessels and can eventually lead to coronary artery diseases. Next, we have here hypertension. Obviously, it is high BP. Yes. Having a high blood pressure damages the arteries and increases the buildup of plaque. As blood pressure increases, your risk of developing heart problems is also high. Next, we have this one, age. What age for male? It is greater than 45 years old, and for female, it is greater than 55 years of age. We have what we call also the right here wear and tear theory. This one, as we grow older, the body will also deteriorates. Okay, race, it is the African American. And then next is family history. And then for the gender, it is male. Most probably it's due to their lifestyle. Let's now proceed to the next slide. Diagnostic exams. Troponin I, the most recommended diagnostic test due to its sensitivity and accuracy. Troponin should not be found in the serum of a normal person because it will only be released when myocardial necrosis occurs. Next, CKMB. It is a creatinine kinase found in the myocardial muscle. Its level increases within 3 to 12 hours of onset of chest pain. Reach peak values within 24 hours, and it will return to baseline after 48 to 72 hours. Positive increase of myoglobin will also be seen within 1 to 4 hours from the onset of chest pain. For the ECG, the result will be, this is very important, just take note of this, T wave, inversion, ST, elevation, and pathologic Q wave. This result will give you an input that it says myocardial infarction. Next is the cardiac catheterization. This is an invasive procedure to diagnose and at the same time to treat certain cardiovascular conditions. In this procedure, the catheter is inserted in an artery or vein in the patient's groin, neck, or arm and threaded through the blood vessels of the heart. Let's now proceed to the next slide. Signs and symptoms. Feeling of impending doom, chest pain that cannot be relieved by rest and nitrates, and shortness of breath. Okay, this three is due to the decreased oxygen supply to the heart. Third, we have the increased heart rate and contractility. This happens when the sympathetic nervous system is stimulated to release epi and norepi due to decreased cardiac output. So for short, decreased cardiac output will result to stimulation of SNS to release epi and norepi, which will result to increased heart rate and contractility. And then, aside from increased heart rate and contractility, it will also result to potent vasoconstriction, which will result to indigestion, pale, cold, clammy skin, and decreased urine output. Due to potent vasoconstriction, there will be a decreased perfusion to the GIT. Decreased perfusion to GIT. And then decreased perfusion to the skin. And lastly, there will be also decreased perfusion to the renal. So these are the common signs and symptoms of myocardial infarction. Next is management. The goal is to minimize myocardial damage, preserve myocardial function, and prevent complications. So I have only three here. First, we have percutaneous transluminal coronary angioplasty, or the PTCA. This is done to restore the blood flow to the coronary arteries. This is the insertion of long, thin tube or catheter in the blocked artery. Once it reaches the blocked artery, they will inflate a small balloon to reopen the artery which is being blocked. This will allow the blood flow again. The surgeon may also put a stent to prevent the artery from closing again. So how it works? We'll try to draw simple draw here. So this is the blood vessel. This is the blocked coronary artery. This is the plaque. They will insert a long thin tube or the catheter here, and on the tip they will inflate the balloon. So it will be like this. When after inflating, it will be like this. The plaque will stay at the sides due to inflation of the balloon. And then after inflation, some surgeon will put a stent here to prevent the artery from closing again. So the blood flow will be restored. Okay. Next is atherectomy. Atherectomy, it is the removal of plaque that causes the block of the coronary artery. In this procedure, there may be a tiny blades or a rotating tip on the end of the catheter. So the blades on the tip of the tube or on the tip of the catheter will be the one to remove the plaque slowly. So here again, the artery, the plaque, the tube, the catheter. There will be small blades here that's rotating and slowly removing this plaque. So after removing, there will be only maybe few plaque here. Okay. Next is the coronary artery bypass graft. This procedure also improves the poor blood flow to the heart. In this procedure, blood vessels from another part of the body, like the arteries from the arm or chest, or veins from the legs, are being used. Then it will be connected to near the affected blood vessels, bypassing the blocked or narrowed artery. So it will be like this. This is the blocked coronary artery. This is the plaque. This is the okay. Once they get an artery or a vein in another part of the body, like what I've mentioned, it may be an artery from the arm or chest or a vein from the legs. So they will connect it here, an artery or a vein, they will connect it, then it will be connected also here and here. Then another one. So this will be opened. This will be also open. So the blood flow will go here, bypassing the blocked artery. So it will stay. Okay, so that's it. That's my simple way to show how it's done. Next is nursing interventions. First, oxygen administration as ordered. Second, give morphine as ordered. Morphine is very important, especially on MI, because of the pain that cannot be relieved by nitrates and rest. So morphine usually is given. Just always check the vital signs. especially the RR, because morphine can cause decreased respiratory rate or respiratory depression. And then always prepare for Narcan, which is the antidote for morphine toxicity. Complete bed rest should be observed as ordered on the first 48 hours. Inform the patient the importance of complete bed rest so that the patient will comply. Next is frequent change in position. This is to help to keep the fluid from pooling in the bases of the lungs. Next, administer thrombolytic and anticoagulant medication as ordered. This is given to dissolve the clots. Next is administer antiplatelet drugs such as clopidogrel as ordered. This is given to prevent new clot formation and existing clots from growing. So almost the same. This one to dissolve the clots. Next, number 7, give lidocaine as ordered. This is for the presence of this is for the presence of dysrhythmias. Dysrhythmias is the one I've shown you before in the ECG result of patient with MI. Lidocaine is the drug of choice, but if it's not responsive or the patient is with allergy to this medication, they will give also, they will also give procainamide. This is the other drug of choice aside from lidocaine. The next, give antihypertensive drugs as ordered. We have a lot here. First, we have the calcium channel blockers. Next, beta blockers. That's beta blockers. And the ACE inhibitors. These drugs are used to lower the blood pressure and decreases the severity of damage and stress to the heart. So therefore, we need to monitor the blood pressure. Next, give anticholinergic and cardiac glycosides, digitalis medication as ordered. These drugs lower the heart rate and strengthen the contraction of the heart. So these drugs strengthen contractility and lower heart rate. This is heart rate. Therefore, monitor the heart rate and watch out for digitalis toxicity. Watch out for toxicity. Next is monitor vital signs. This is very important. Tissue perfusion, pain scale, urinary output, and laboratory values. Lastly, advise the patient to avoid exertion and stress. So that's it for today. I hope you understand and learn something about our discussion related to myocardial infarction. See you on our next video next Friday. Thank you for watching.